This is the skin assessment. Sharon, do I have permission to video record you and put this over the internet?
Yes, you do.
Okay, thank you, Sharon. I have a few questions to ask you. Any history of hair loss, or have you noticed any hair loss, brushing your hair, any bald spots?
No.
Okay. Any nail infections?
No.
Do you have artificial nails at all?
No, I do not.
Okay. Is there any history of cancer in the family?
There is.
Who has the cancer?
My dad's mother and my mom's father.
Okay. Do you know what type of cancer that was?
Basal cell.
Okay. So, sun exposure. Do you understand that that's a risk for skin cancer?
I do, yes.
And do you use sunscreen
I
when
do.
you're in the sun? Do you burn easily?
Yes.
Okay, so it's important for you to know to get your skin checked once a year. If you notice any irregular shaped mole, make sure you point that out to your family physician and use sunscreen. Okay, I'm going to do a quick assessment. Okay, looking at your hair, it's nice and shiny. I'm going to just look through it quickly, kind of separate. Very thick hair. I don't see any bald spots. And I'm noticing that you have nice even pigmentation, good skin turgor. It goes right back, so obviously not dehydrated. But I am noticing some scattered lesions on your arms. Can you tell me more about that?
Yes, I was diagnosed with urticaria pigmentosa when I was 3 years old.
Urticaria pigmentosa. Can you tell me a little bit about that?
Sure. The pigments turn into hives when they're irritated by hot water or scratching.
So do you have food allergies that trigger that as well?
Some foods do trigger it, especially with artificial flavoring, yes.
Okay. And with this urticaria pigmentosa, that's very rare?
It is very rare.
Okay. Does it go away?
They told me it was supposed to go away through puberty and has not gone away.
I see. So is there any harm that can come to you by having urticaria pigmentosa?
I'm following up with a dermatologist to check to make sure it doesn't turn into mastocytosis.
Mastocytosis. So mastocytosis is a systemic urticaria pigmentosa. A systemic mast cell gets triggered and can cause problems with GI, pretty much on any organ system, correct?
Correct.
Do you mind if I look at your tummy?
Sure.
Okay. Can you show me you can see
Pigmentation all over.
the scattered pigmentation. You don't have any irregular shaped moles anywhere though?
No.
This is just it. Okay, thank you. You can put your shirt down. And I'm going to look at your legs. Very good. Even color. I see a few scattered spots of the urticaria pigmentosa there as well. And I know that that's what it is because they're slightly raised and they're reddish brown that kind of match what was on your tongue.